Dr. Zhitnitsky, I would like you to talk about sleep apnea, that thing which people have when they, I guess, snore, not get air. Anyway, tell us about it, how to treat it, tell us the dangers of it, the effects of it, and all the ways of treating it.
Well, sleep apnea is a relatively newly discovered disease, and it affects a lot of people. I happen to be a patient of it also.
What's relatively newly? A decade, 2 decades, 5 years? What's new? What's relatively newly mean?
Well, maybe about 10 years ago, people have started figuring out that maybe we don't have the quality of sleep that we need to have. A body needs time to recuperate.
Mm-hmm.
And some people sleep and they snore. And that is normal as long as they don't stop breathing. Some people stop breathing up to 100 and 150 times during the night. And every time they stop breathing, they wake up. And they don't achieve regular sleep for a prolonged period of time. And their body is tired. They drive their car tired. Sometimes I have my patients telling me that I fall asleep on a red light. And people think that we're all stressed out and because of our busy schedule. But a lot of the times it is because we just can't get enough sleep. In fact, Starbucks coffee culture may be related to our sleep apnea because people drink so much coffee to keep themselves awake.
Cheers.
And there you go.
Okay, I see.
The standard of care for sleep apnea is something that's called a CPAP machine, which is a bulky mask that straps onto your face and forces air down your throat at a regular interval.
Okay.
And many people have to wear it at night, and that's the only way they can get some sleep. And the advantage of this machine is that it actually works and helps you sleep. The disadvantage of it is that it's very bulky. If you're traveling somewhere, you have to take it with you. It needs an electrical connection, so you can't take it camping, for example. And you have to walk around with an extra suitcase. A lot of people get claustrophobic because it's a mask that fits over their mouth and nose, and people can't breathe very well in it. So what we have is that we have a dental alternative.
Wait a minute, you just said because of it you breathe well, so now you're telling me you can't breathe in it very well.
Well, no. People think that they're choking.
They think they're choking because they're claustrophobic.
It's a mental issue. It's a mental issue.
I got it.
So an alternative to that treatment is a dental device that you wear at night that positions your jaw in a special way that doesn't let your airway close. Doesn't let your tongue fall back into your throat and close your airway. It doesn't force any oxygen down your throat, but it lets you breathe normally. And there are some companies that actually have devices that are very comfortable to wear, or where you can even talk. You can get up and have a sip of water with it without actually taking it off. And a lot of people have been found this to be very comforting. And even if they use a CPAP machine regularly, when they travel, they will take a dental device with them. If they go camping, they take a dental device with them. It's a very good second alternative to a CPAP machine, or for those who don't use it. And again, it's a question of not getting enough sleep. It's not only a question of you drinking coffee and being drowsy during the day. If your body doesn't get enough rest, you're at higher risk of a heart attack, you're higher risk of a stroke, your nerve conditions develop, you may be depressed.
Right.
So everything relates to other conditions. So it's very important for everybody to get, as they used to say in the old days, you have to get your 8 hours of sleep. But even if you're in bed for 8 hours, you might not be sleeping. Some patients that we have only sleep 2.5 hours out of that 8 hours.
Well, how do you find out? Are there any tests for that?
Absolutely.
What's the first step? First of all, tell me, what's the first symptom that a person should say, or not the decent symptom, but what are some of the symptoms which a person notices, such as you said, kind of like unreasonably getting tired in the afternoon, kind of, wait a minute, this is not normal, I'm not, or something like that. And what else, what other symptoms are there that he should say, let me see whether there's something in that area, like with the headache. Headaches don't go away. You go to a couple chiropractors, you change your pillows, they still come and go. Well, let's go and include a dentist because maybe your mouth is out of alignment somehow, for whatever reason. When is the time to go and say, let me test my sleep, and then how would that test go?
Well, obviously, if you're tired during the day, if you drink a lot of coffee,
okay.
If your bed partner tells you that you snore a lot,
okay.
Snoring is one of the telltale signs that you may have sleep apnea.
I see.
If you have a large neck size, not unnecessarily that you're overweight, but if your neck is pretty large, I think for men it's over 17 inches.
Really?
There's a chance because when you're lying on your back and your tongue is relaxed, that mushy part actually falls back into your throat and constricts it.
I see.
And it's a very easy. The initial test is a questionnaire that we ask patients to fill out to see if they're at risk. And if it shows that they're at risk, they would be referred to a special sleep center where they actually do a sleep study. And they measure exactly how many times during the night you stop breathing and what is your oxygen level and how many times your brain is getting deprived of oxygen. And from there, we will work out a treatment to solve the problem.
So you're actually going to spend the night somewhere else?
Yes. Most patients have to spend the night in a sleep center. There are some centers that actually will give you a little device to take home with you when you can sleep in your own bed, and it measures everything.
Okay. That sounds more reasonable.
But most of the time, it's a small price to pay to be able to live your life at a better level afterwards.
Right.
Because people are truly happier.
Right. Well, obviously, number one, sleep, and number two, oxygen. Oxygen's, looks like a rather important thing to me. So if you get getting deprived several times a night for, half a minute or a minute, whatever it may be that you get deprived, maybe on a short term that doesn't do too much, but you do that for decades. It looks to me that, obviously your overall body function must be diminished, because why wouldn't it if you constantly, it's like not giving your body food. Obviously over a long period of time, you can live a day or two on McDonald's hamburger, no big deal, do it a whole life, and obviously you won't be another Arnold Schwarzenegger if you do that, you know what I mean? It's just that simple,
For example, if you're in a hospital operating room, right, and the oxygen level of your blood drops below 90%, all the alarms start going off. And some patients that we have that suffer from sleep apnea, their oxygenation in their blood drops to 75%.
Holy cow! So if I'm getting my appendix operated or whatever, my hip replaced, and I'm there laying, not moving, and I'm hooked up to these machines, and they measure, one of the things they measure is the oxygen level, is what you say. And that oxygen level has to be, what you said just now?
90% or above.
90 or above. So if it goes down to 88, the flashes starts ringing and the doctors start doing something.
Alarms go off. Absolutely.
They start pumping oxygen into you or something. They do something. Wow. And then you say there are people who go around the 70 because of sleep apnea.
Right. And it happens several times a night.
Holy cow. So basically,
you might not be a doctor, but you have to understand this definitely is not good for you.
No, you don't have to be. For certain things, you really, you just got to understand the basic. And no, that's not good. That cannot be good. So no wonder then you, start becoming even forgetful and name it. Because that's what, that's what this thing is, no oxygen stuff.
Some doctors call sleep apnea an epidemic right now, because there's a lot of sleep apnea is not only a damage to your body, it's damage to your people around you. A lot of people get into car accidents because they fall asleep at the wheel. In fact, if you're a truck driver,
you hear about that all the time.
If you're a commercial truck driver, you cannot have sleep apnea. If it's not controlled, they will not issue a license.
Makes sense. But there's lots of more normal drivers than drug drivers out there, and they don't get checked.
Right. Right. So a lot of times people they even call it now drowsy driving. There's a term for it.
Yeah. So tell me, and I'm by my friends I'm usually called, and people who know me, I'm usually called a quite active, never tiring robot. However, the truth is this: I do sometimes wake up and I love to sleep. I'm sleeping 9 to 10 hours. That's, I'm kind of a workaholic. I'm a workhorse. I'm out there, but I do definitely sleep. And so does my wife. But the fact is, we do sometimes, I personally think more often than I like to, wake up like I'm not quite here. Damn it, what's going on? And I did sleep my 9 hours. Do you understand? Do you think I should do something? And I do snore.
You wake up tired.
I wake up tired a little bit, not super tired. And as I said, my co-workers and friends, they think I'm like, of course I take hot and cold shower, even in winter. So, it rattles me back to life. But, actually I wake up tired. Yes, I do. Not always, but sometimes. More often than I like.
Yes. It's not only the number of hours you spend in bed. It's also how far you go into sleep, how deep your sleep is, whether you go into REM, which is rapid eye movement sleep, whether you have dreams. Because if you can't get any dreams, you could become psychotic. Dreams are very important, and you have to get to a certain level of sleep to get dreams.
And
so it's very important.
If you stop breathing and you wake up, as you said, then you interrupt that cycle?
You interrupt that cycle. You don't go to a sufficiently deep level of sleep.
Jesus. Well, I think we should work more on letting people know about it. People listening to this, yes, I do think even if you have to spend a night away from home in some lab, being hooked up to I don't know what, but couldn't be that bad, I guess.
It's called the lab, but it's basically a bedroom with a couple of monitors in it.
Well, all right. Because, in my humble opinion, having cruised around the world, working, living, I have seen nothing more devastating to people but being tired and exhausted, and by doing so lifeless. Never mind coming up with new ideas like Microsoft, IBM, or with Amazon.com. Never mind that type of stuff, but it's solving the everyday little problems. Here's what happened 22 years ago when my wife and me met and got married. She would accuse me of being upset with her every so often. And I go, honey, I'm not. And she says, yeah, but you're not talking to me whether I sit in the kitchen table or in the car, because normally our mouths are shouting off. And it took us about a year to realize, no, I wasn't upset. I was just tired. You understand?
Yes,
now, I'm not saying it's all from sleep apnea, obviously, but the point is, when we're tired and exhausted, we are lifeless people. We don't have imaginations of joy. And so it looks to me this is an enormously important subject.
You're absolutely right, Helmut.
Thanks a lot, sir.
It relates to the quality of your life.
I think this is important. Thank you very much for enlightening me.
Thank you.
And I hope the viewers feel the same way. Bye-bye.
Bye-bye.